hyperthyroidism. And I'll be relating the signs and symptoms of hyperthyroidism to nursing care and describing how one impacts the other. My name is Nicholas Pontes, and I'm presenting this for my older adult health course. So first, just real quick, I want to go over a basic understanding of the thyroid. The thyroid itself notably regulates the body's metabolic rate. And the reason I describe that as the notable role of the thyroid is in a lot of the signs and symptoms we'll be seeing will be directly related to an altered state of metabolism. Besides that, I mean, that metabolic rate and hormone production as a whole affects the heart, the muscle, bone maintenance. There's even more than that. And hyperthyroidism is going to be what happens when all of those are just kind of all that metabolic control is dysregulated and everything's turned up a little bit. So the big hormones to understand with the thyroid are thyroid stimulating hormone, which more or less tells the thyroid to get producing. And what it's producing is T3 and T4, notably, which impacts the rest of the body's impact the body's metabolism. Also, an important substance to know is iodine, as it will also come into play with the signs and symptoms and diagnostics that are related to that, as iodine is necessary for healthy thyroid function, and a possible cause of hyperthyroidism is going to be an excessive level of iodine within the body. Okay, now onto the kind of meat of what we're going to be talking about today, the signs and symptoms of hypothyroidism. Now, this is a chart I created as a study tool for my Adult Health 1 course, as we're talking about the thyroid right now. And that headline right there says hypothyroidism. I was pretty careful to not type hypothyroidism anywhere in here, and it appears I missed something. I'm going to keep going because honestly the first minute of this went pretty well. But anyways, okay, so the signs and symptoms of hyperthyroidism. The reason I include these other spots, such as related conditions and causes and risk factors of the condition, is that a lot of sources that describe the signs and symptoms of hyperthyroidism will include Graves' disease over here as not just a cause, but a symptom of what the thyroid is going to be doing. Okay, that wasn't very fluent. But anyways, the signs and symptoms. So just going down the list, fine hair, exophthalmos, hyperactive symptoms. So I think this one especially makes sense in the context of a kind of fast metabolism. So restlessness, emotional instability, insomnia, nervousness. These are all, I mean, if your metabolism is going really fast, then your body will have a difficult time relaxing. And a lot of these are at least partially related to that. I'm definitely going to be talking a lot more about these as I discuss the interaction between the signs and symptoms and nursing care. This next one is also very important for the nursing plan of care, and that is a goiter, which is a medical term for basically a swollen thyroid region around the neck. Besides that, sweating and heat intolerance, also directly related to metabolism, increased appetite, still metabolism, cardiac symptoms. One of the most direct impacts of the thyroid is going to be the cardiac system. And so cardiac is supposed to be kept steady, and escalating the hormones that impact the heart as well as any thyroid function beyond what it should be, they may lead to hyperactive cardiac systems, basically, which will look like arrhythmias, tachycardia, palpitations. Anyways, besides that, we have muscle wasting, weight loss, fine tremors, oligomenorrhea, diarrhea, and weight loss, all of which will be discussed following. So what the idea of, just real quick, just to describe the citation for this, all this information was directly obtained from the Overbaugh textbook we use for Adult Health 1. Okay, so it's simple enough to look in a book and get the signs and symptoms for hyperthyroidism, but to apply it to the nursing process is it's really what we're here to do, right? And though a lot of what I've discussed so far and what I will be discussing is more or less relevant for all ages, I will be discussing directly how we can expect this for older adults as well. So I'm going to look directly at ADPI as a kind of structure to describe how signs and symptoms will impact nursing care, as each of the steps are somewhat considering the signs and symptoms of hyperthyroidism as the nurse works through this process. So, assessment. Which signs and symptoms will initially stand out? I want to take a brief moment here before I even discuss the signs and symptoms to talk about risk factors for hyperthyroidism, because older adults have one of the greater risk factors. Even I said it before on this slide over here, is that ages 20 to 40 are the most substantial population that gets hyperthyroidism. And older adults, as described in Diab et al., have a less than 1% incidence of hyperthyroidism and is substantially less than that age group of 20 to 40. Though other risk factors, such as women are 8 times more at risk than men, those still hold true even with the lower incidence. So I described that in the assessment portion, because if an older adult is presenting with diarrhea and tremors, you may be less prone to kind of assess for the whole hyperthyroidism rather than more likely causes of diarrhea. That being said, assessment that should make somebody consider hyperthyroidism, looking at the signs and symptoms, I'd say the most direct to hyperthyroidism would be that goiter, the swollen neck region around the thyroid. If there's a swollen thyroid, that is indication that the thyroid's working too hard. The thyroid should not protrude under normal conditions, and therefore that signs and symptom will be big for assessment. That being said, a lot of these other signs and symptoms are very visible. Fine hair, exophthalmos, sweating. If the patient is asking you to turn the heat of the room down, even though it's a perfectly normal temperature, maybe it's just a patient crafting their environment, but maybe it's indicative of a thyroid issue. Fine tremors. Also, while there are a lot of things that could be causing that, at least it feels like that way in nursing school. Seeing that in an age 20 to 40 population, you'll definitely be considering hyperthyroidism. Other assessment data, including, let's say, hyperactive symptoms. Now, how will this impact your nursing care? It's not just, which signs and symptoms will you assess? That's going to be all of them. But as far as which may impact your actual interaction with the patient, hyperactive symptoms might mean the patient you're trying to assess is nervous and hasn't been sleeping well and is a little emotionally unstable. And therapeutic communication, if it isn't already super important, is going to be even more important in the context of trying to maintain a calm and low stimulation environment to take care of this patient. Let's see, besides that, you will want to evaluate their heart sounds to try to notice any abnormal like S3, S4. Assessment will include, patient questionnaires, including, how have you been eating recently? Maybe indicates increased appetite. Let's see here. How have your bowel movements been recently? Maybe indicative of diarrhea. Weight loss as well is something that can be noted through assessment questionnaire right at admission, even though it will show itself with time in the nursing environment. All right, now moving on into diagnosis. So the signs and symptoms, they're probably helpful getting you to run the lab tests that are absolutely necessary to diagnose something like hyperthyroidism. While I didn't include the citation on this slide, I have all the references at the end. Doubleday et al., Doubleday and Sapel describe the importance of noting increased T4 or decreased serum TSH as a diagnostic for hyperthyroidism. Now, you're not just going to run that lab on anybody, but noting the signs and symptoms of hyperthyroidism will indicate getting those labs drawn. And so diagnosis fundamentally requires a strong understanding of the signs and symptoms to even get to this point. Moving on to planning, this is also a Doubleday. How do the signs and symptoms inform the plan of care for a patient with hyperthyroidism? It was described that, first of all, this person may be experiencing hyperactive symptoms, And while this impacts how you'll be, sitting next to them as you assess them, or standing next to them, I suppose, it will also impact the environment you plan to create for them, as far as attempting to create something calm and attempting to alter their diet to meet for example, the symptom of diarrhea. That will encourage a diet of high calorie, high protein foods. So that's just one instance of signs and symptoms impacting the plan of care. The signs and symptoms are required more. You're very unlikely to run a TSH or T3 or T4 test if you don't notice the signs and symptoms. And it's the results of those tests that will encourage anti-thyroid agents such as methimazole and propylthiouracil. It's a mouthful, which are necessary for which reduce those thyroid hormone levels. A little less direct of a tie to signs and symptoms, but still there. I discussed a little bit earlier, actually, to go back to diagnosis just for a moment, discussed a little earlier about how iodine, especially in the Graves version of hyperthyroidism, which I will also just talk about in a moment, can be elevated, and that iodine level labs are another lab that you will probably want to obtain as part of an understanding of thyroid function. Besides that, hyperthyroidism, plan of care. Let's see, what else? Weight monitoring. If a substantial sign and symptom of hyperthyroidism is weight loss, then that's going to indicate planning the care to include daily weights. Okay, and then let's see what else. Okay, I said I would talk about the different types of hyperthyroidism. This is another one of the conditions I left in here. Just Graves, there are different things that can cause hyperthyroidism. This was also described in Doubleday et al. And so TSH and T3, T4 both can be relevant to hyperthyroidism. Now, if there's the hypothalamus, releases, a region of the brain releases thyroid stimulating hormone, which tells the thyroid to produce T3 and T4. And it's those hormones, those elevated levels, that are indicative of hyperthyroidism. However, so if there's excessive TSH being released, that may indicate a problem with the brain, which should be releasing less TSH. Meanwhile, if there's just increased T3, T4 without an increase in TSH, that may be indicative of a problem with the thyroid. Meanwhile, Graves' disease is an autoimmune disease where immunoglobulins are the reason that there's excessive thyroid stimulation, producing all those hormones. And all of these are less likely, but still possible in an older adult population. So as far as the ability to implement a treatment plan of hyperthyroidism, this has been, it's a more or less the same point that has been made before, that somebody with hyperactive symptoms will be different to care for than somebody who has, for example, hypothyroidism, who may be depressed and lying down as largely symptomatic of that condition. Just excessive, you want to maintain an environment of low stimulation, and by interacting with the patient, you want to be calm with the patient. Now, as far as evaluation of how the treatment of the treatment of hyperthyroidism, relating this to the signs and symptoms, we want to largely be seeing symptom relief. So as far as treating the actual thyroid, do they still feel the increased in appetite? How does their mood adjust? Are they cardiacally stable? As far as treating the symptoms, we want to resolve the diarrhea. We want to prevent further weight loss. And just the signs and symptoms, though we are attempting to treat the abnormal levels of thyroid-related hormones, treating hyperthyroidism will include treating the symptoms of the diarrhea and the weight loss that are included in there. And that's all I've got for today. Here are the references used for this presentation, and that's all I've got.